team. The AMA PRA Category 1 credit, CME 1 hour for the entire webinar, nursing, continuing professional development, and CPD 1 credit hour for entire webinar. The interprofessional continuing education, IPCE 1 credit hour for entire webinar. The disclaimer, Project First Line is a national collaborative led by the U.S. Center for Disease Control and Prevention, the CDC, to provide infection control training and education to frontline healthcare workers and public health personnel. The National Indian Health Board has partnered with Project First Line as supported through cooperative agreement CDC RFA CK20 2003. CDC is an agency within the Department of Health and Human Services, HHS, and the contents of this webinar. The projects of this webinar does not necessarily represent the policies of CDC or HSS and should not be considered or an endorsement by the federal government. Satisfactory completion, learners must complete an evaluation to receive a certificate of completion. You must attend the entire webinar, as partial credit is not available. If you are seeking continuing education credit for a specialty not listed, it is your responsibility to contacting your licensing certification board or licensing certification. So we'll get started with the presentation. This is a picture of Lake Sakakawea on the MHA Nation. I just wanted to start with something light before we get into this subject. And a little quote is, "Prevention is better than a cure." Dermedius Uranus wrote that, but that just gives you a picture of where I'm at right now. The objectives are to define Clostridioides difficile infection, CDI, discuss the common symptoms of CDI, identify EPA list cleaning agents effective against C. difficile, explain contact precautions, and discuss the recommendations for preventing a CDI in long-term and acute care settings. What is C. diff? Clostridioides difficile, C. diff, and C. difficile all mean the same thing. C. diff is a germ that stems from a bacterial infection of the large intestine that causes diarrhea and colitis. Colitis is inflammation of the colon. Most cases of C. diff occur in patients taking antibiotics and usually are caused by patients that are taking antibiotics for long periods of time and numerous antibiotics. And what triggers a response of C. diff is they become immune. C. diff can be spread by not cleaning hands, equipment, and the environment properly. The primary mode of transmission is by person to person, spread by focal oral route. Look at the first image on your left. This micrographic depicts gram-positive C. difficile bacteria from a stool sample culture obtained using 1.1 uranium filter. Photo from the CDC, Janice Carr. In the second image on the right, codicil difficile colonies are shown on a agar slide after 48 hours. How is C. diff spread? C. diff germs spread in poop or stool, and then bacteria often found in the environment. C. diff can spread easily from person to person or on contaminated equipment such as blood pressure cuffs anything that touches a patient, thermometers, O2 sat monitors, um, and contaminated surfaces such as bed linens, bed rails, bathroom fixtures. Reducing the spread of C. diff by washing your hands with soap and water, using the bathroom, and always before you eat. Here's a question for everybody. How is C. diff spread? The answer is fecal oral route. Symptoms of C. diff infection are watery stool, diarrhea, fever, loss of appetite, nausea, belly pain, and tenderness. The most common symptoms, usually what you will see in the patients, you'll notice blood and mucus and pus in the stool. There's a very strong odor. A lot of times with the fever, they'll have belly pain that is really they're very ill. Most of the time, the C. diff patients are elders because they're the ones who usually use antibiotics for a long period of time. Here's another knowledge question. True or false, healthcare workers can identify C. diff based on the color and smell of the stool. And as we went through, it's not easy for anybody to just know that they have C. diff. It has to be done by testing. Why are the residents in long-term care facilities at higher risk of C. diff infections? Why? A lot of the reasons are possible responses are, they could be numerous reasons. And if anybody has some suggestions why, please answer. Some of the risks are CDC increases in patient residents who are given antibiotics. Like I said, a lot of antibiotics numerous times for things, they become immune. They're age 65 years and older with a weak immune system, recently discharged from a healthcare facility, and they also have a history of C. diff infection. On the stuff that I just wrote, that I just read ahead, there is a nice, the CDC has some nice colorful tools that people can get if they think there's a C. diff infection, or if you want to educate your staff on getting them. Basically people that have decreased immunity, people who have numerous injury, or I'm sorry, people who are immune compromised, diabetes patients, HIV patients, anybody that like that, they definitely will be on the high risk and impact schedule. And here is a copy of the form that's in CDC under the C. diff impact and risk. It's a pretty nice little tool to use easily. Like for cultures like Native American cultures, sometimes pictures were really good. I know it's kind of wordy. Some of the text is wordy, but the pictures are good. Sometimes people who can't, a lot of Native Americans and different populations don't just read English. They have their own language. Pictures really help. And here's another part of it. The spread and prevention of C. diff. These would be, this pictures would be good ones to use too, because preventing C. diff is good infection control. It is the best way to prevent the spread of C. diff from person to person, improving the way antibiotics are prescribed, rapidly identifying C. diff and getting them isolated, and preventing C. diff infections, which means one person getting C. diff on a floor versus everybody on the floor getting C. diff along with staff. Here's a good picture of what C. diff, they're gram rod positive. This is what they look like in the stool. And then if you took a microscopic picture of them. C. diff spores make pathogen germ removal difficult because the protective coating allows them to live for months and years on surfaces and in the soil. So that's something to think about. They're very hard to kill. They're resistant to heat and acid. That's why it takes numerous antibiotics sometimes to fight them. Disinfectants, sometimes everybody says they have the perfect disinfectant, but sometimes the basic antibiotics that say they can kill something on any surface is the best one to use, and bleach is a good one. Bleach is usually one of the best ones, especially for spores. And cleaning your hands with ABS or soap and water can remove spores from your hands. Good hand washing usually is one of the best things that help. Elements of the germ spread, as you can see, the reservoirs, they touch it, infected person, pathways, like we said, giving blood, touching stool, touching any bedding, body defenses, we try to fight it off. A lot of people can fight it off, but if you're compromised or you're an elder, it is hard to fight it off. Germ survival, as you heard, they can live in soil, they can live on hard surfaces, they can live in bedding, they can live in your body and not be detected and be dormant for a long time. So to stop the chain of infection, the 5 elements are required for germ to spread and cause of an infection are reservoir, pathway, person to infect, getting around the body's defenses, and survival. Sorry. How can CDI be prevented in hospitals and other healthcare settings? How do we think that's going to happen? By contact precautions, by making sure that the number one thing to stop this, so if everybody would know this, it's good hand hygiene. It's washing the hands prior to entering a patient's environment, washing the hands after leaving the patient, making sure you're wearing gloves, making sure you're washing your hands prior to putting the gloves on and taking the gloves off, and prior to leaving the patient's environment. If everybody did good hand washing, we probably wouldn't have contact precautions, or we wouldn't have a lot of the simple contact things that happen like C. diff. The CDC prefers alcohol-based hand sanitizers for routine hand hygiene in clinical settings or situation because it's easier to get in and effective against most types of germs as long as it is at the least 60% alcohol. However, good hand washing and making sure that you're rubbing your hands under running water with a soap for 30 seconds has proven that it's just as effective as any of the alcohol-based sanitizer. Clean your hands thoroughly. Cleaning your hands thoroughly. Remember that the ABI and soap and water to be effective, you must clean all the areas of your hands. Do not forget your fingers, fingernails, wrists, and thumbs. In addition, people who have long fingernails or a lot of jewelry, you want to make sure that you're getting underneath your fingernails and maybe not wearing so much jewelry, or making sure you're taking the jewelry off when you're cleaning and reapplying your jewelry. Which hygiene rate routine is suitable to prevent C. diff? As we said, the best prevention is soap and water and alcohol-based hand sanitizer. Another thing that helps with it is personal protective equipment. Anybody who works in any kind of health center, it doesn't matter if it's in a nursing home or a hospital or even home health, you want to make sure that you're protecting yourself. Hospital staff and visitors should always wear disposable gloves and gowns when entering the patient's room or providing care. They should also be able to wear eye cover and make masks if needed. PPE should be removed and hands should be washed when exiting the room. Remember, you have to protect yourself as well as the resident or the patient, whichever room, whenever you're walking in. And I try to do the same thing. Even though you're going into somebody's house, I got to protect myself as well as them. Cleaning and, oh, let's see. Cleaning and disinfecting. Cleaning. So differentiating between cleaning and disinfecting is important for C. diff spores. Facilities must consistently clean and disinfect while caring for residents with confirmed or suspected C. diff infections. When cleaning, you want to make sure that you are touching on all the areas that need to be touched on for the patient's room, which means the bedding, the bed, the bathroom, especially the bathroom. And you want to make sure that you hit all the hard surfaces. Disinfecting is somebody, after you notice when somebody leaves a hospital room, they go in. If somebody has C. diff, they go in their gown, their mask, they go in and make sure they disinfect the whole room, and the whole room is closed and cut off for a period of 24 hours. That's the way that they help make sure it's disinfectant for the next person. Surface cleaning steps. You put on gloves and gown. Make sure all healthcare providers clean their hands before and after caring for residents. Spray or squirt cleaning solution onto the surface, wipe and rub the surface, moving in one direction until visibly clean and also looks clean to you. Follow the procedure by rinsing and allow the areas to dry. Disinfecting hard surfaces such as restrooms. Sometimes you have to take more precautions because that, of course, C. diff lives in the stool. So you want to make sure that the bathroom is hit the hardest for disinfecting. The EPA List K, products on EPA List K are registered with the use against C. diff spores. The EPA has reviewed laboratory testing data demonstrating that these products do not kill C. diff. There is a list of EPA products that can kill C. diff, and the facilities, whatever facilities you work at, they should be able to get this, and it would be like in their MDS manual, which means their cleaning manual that is approved for every facility. They would have it on there. You want to make sure, and if you have any questions, you can always go to the CDC website to get the approved cleaning products. And here's a copy of the EPA's registered products. I'm sure that you guys can look at this and realize something maybe you want to give to your cleaning crew, or if you're in charge of an area, you would want to make sure you make a copy of this. This would be helpful for any facility that does any type of long-term cleaning, like nursing homes, hospitals, or even a patient's home that has had positive C. diff. Which of the following is not correct regarding prevention and control of C. diff in the healthcare facilities? Clean and disinfect with the EPA list N. Here's a little thing, just a little bit to take our mind off of C. diff. This is a Earth Lodge from our tribe. Okay, key takeaways. C. diff can be passed on by hands, shared patient equipment, and contaminated surfaces. Use contact precautions for residents with known or suspected C. diff infection. Use alcohol-based hand sanitizer unless hands are visibly soiled. Wear gloves and gowns. Private room if possible. You want to cut them off from everybody so the whole floor does not get C. diff. With dedicated bathrooms for the contaminated person. Maintain contact precautions during duration of illness. Clean surfaces as soon as possible as they become soiled, which means continually cleaning and making sure the areas are clean for the patient area and equipment often. Here's a list of some of the resources that were used in this presentation. And I'll just leave you with a little greet each day humbly and ask all thanks for the great spirit above. Thank you. If you have any questions, please type them.
Hello, everyone. Thank you for the excellent presentation, Rose. We will now move on to the Q&A portion of the webinar. If you have any questions for Rose, please raise your hand or come off mute and ask your question. But before we have any questions, I kind of want to bring a spotlight to a question that was asked or a statement that was stated in the chat box about hand sanitizer does not kill spores, must use soap and water. That is absolutely true. However, CDC has a new guidance where we have to use alcohol-based sanitizer after um, after coming out of a patient environment, whether it be a room. And so that was something that was stressed when putting this presentation together. CDC subject matter experts want everyone to know that you have to use alcohol-based hand sanitizer unless, of course, your hands are soiled with C. diff matter, then if you have to use soap and water. But are there any other questions? Otherwise, please take some time to fill out our survey. I will post it here in the chat box. And some announcements that I kind of want to make. So our next webinar will be August 7th, which is in a couple of days, on fabricating safety, managing infection risk in healthcare linens by Greg Jawowski. I will post that link to register for that webinar as well. Here's the link to the August 7th webinar. And if you have any questions or ideas about future webinars, or if you'd like to be a presenter, please email us at infectiousdiseases@nhb.org. I will put that email in the chat box. Also, if you have an interest in participating in the ICAR training, also email us and we'll send you the link to register for that as well. So again, our recording and slides will be emailed to you via email. And again, I would like to thank Rose Davis for presenting on C. diff today. Otherwise, if there's no other questions, that concludes our presentation for today. Thank you, everyone, and